Saffron is used for depression, PMS symptoms, postpartum depression, memory, appetite suppression, energy and stamina in athletes, and preventing neurodegenerative diseases like Parkinson's and Alzheimer's. It's the dried stigma of the Crocus sativus plant that's native to the Middle East. It's the world's most expensive culinary spice, largely due to the way that it must be grown and harvested. As a nootropic, saffron has been used for thousands of years as an anxiolytic, sedative, and antidepressant. Today, saffron is used to help to manage appetite, for energy and stamina, anxiety, and it's a very effective antidepressant. Recent studies show that saffron is effective as some of the popular prescription antidepressants, and it can even help to alleviate the sexual dysfunction caused by these drugs. Saffron extracts inhibit the uptake of dopamine and norepinephrine in the brain, and this helps to improve mood. Saffron inhibits the deposits of amyloid beta plaque, and this is associated with the progression of Alzheimer's disease. Saffron also inhibits the breakdown of acetylcholine, just like the current medication that's approved to treat Alzheimer's. Crocin and saffronol, which are unique carotenoids in saffron, make it a potent antioxidant, scavenging free radicals, which reduces inflammation, preventing apoptosis and protecting brain cells and mitochondria. Saffron is the dried crimson stigma of the Crocus sativus flower that's cultivated primarily in Iran. Documentation of saffron use over the last 4,000 years for at least 90 illnesses has been uncovered. Saffron takes a long time to germinate from seed and 3 years for the plant to flower. Once it blooms in mid-autumn, the flowers must be picked carefully by hand within 2 weeks. Each Crocus sativus plant produces 3 to 4 flowers per season. Each flower produces a 3-pronged style, each prong terminating in a vivid crimson stigma. Saffron is the dried stigma of the Crocus sativus. This labor-intensive production method makes saffron the most expensive spice in the world. Saffron contains the metabolites crocin, picrocin, saffronyl, and the antioxidants lycopene and zeaxanthin, as well as vitamin B12, all which provide it with medical benefits. As a nootropic, saffron may be used for depression, PMS symptoms, postpartum depression, memory, appetite suppression, and preventing neurodegenerative diseases like Parkinson's and Alzheimer's. Recent studies suggest that brain-derived nootropic factor, nerve growth factor, and CAMP response binding protein, CREB, all play a role in anxiety and depression. Further research shows that saffron has a significant effect on BDNF, nerve growth factor, and CAMP levels in the brain. This likely explains why saffron is so effective in treating teenage anxiety and depression. One study in 2018 had 80 participants aged 12 to 16 years with anxiety and depression try a saffron extract of 14 milligrams or placebo for 8 weeks. The study concluded that saffron extract was effective in relieving the symptoms of separation anxiety, social phobia, and depression when compared to placebo. Researchers in the psychology department at Murdoch University in Perth conducted a systematic analysis of every clinical trial that they could find for high-quality, randomized, double-blind studies using saffron, a placebo, and antidepressant medicine as controls in humans. The team concluded that clinical trials support the use of saffron for the treatment of mild to moderate depression. The most common symptoms in Alzheimer's patients is depression, and doctors commonly prescribe antidepressants for the treatment, including drugs like sertraline or Zoloft, despite the fact that these medicines don't work for Alzheimer's disease and they come with a host of side effects. An alternative treatment is obviously needed, so researchers set up a double-blind, placebo-controlled trial with 46 Alzheimer's patients. The patients were given 15 milligrams of saffron twice a day or placebo for 16 weeks. The results of the trial showed that saffron produced a significantly better reduction in behavioral and psychological symptoms than the placebo, and they concluded saffron is both safe and effective in mild to moderate Alzheimer's. The acetylcholinesterase inhibitor doperazil, or Aricept, is prescribed to Alzheimer's patients for increasing acetylcholine, which has been found to be low in these patients. A 22-week randomized double-blind trial with 54 Alzheimer's patients was conducted to compare doperazil with Saffron. The patients received either 15 milligrams of Saffron twice a day or 5 milligrams of donepezil twice per day for the extent of the trial. The phase 2 study found that saffron extract was as effective as the doperazil in the treatment of mild to moderate Alzheimer's, but saffron did not produce the side effects such as vomiting. Depression is a growing health problem, with over 10% of Americans taking prescription antidepressants, of whom 90% experience at least one adverse side effect, ranging from sexual dysfunction to convulsions to bleeding disorders. Antidepressant use can result in abnormal bleeding, agitation, aggression, anxiety, and delirium, confusion, convulsions, and even death. They can decrease memory, increase delusional thinking, hallucinations, headaches, and heart attacks. Insomnia, lethargy, nightmares, and panic attacks, sedation, impaired driving, slow speech, sexual dysfunction, panic attacks, paranoia, suicidal thoughts, violent behavior, serotonin syndrome, and withdrawal symptoms. A growing database of studies and user reviews show that saffron helps to treat depression without the risky side effects of prescription antidepressants. Saffron has been shown to be effective with other conditions for which antidepressants are prescribed, including anxiety, Alzheimer's, and obsessive-compulsive disorder. We even have reports of saffron reversing the sexual dysfunction that's caused by using prescription antidepressants. Studies show saffron could be an alternative to some popular antidepressant medicine, and for anxiety. Another study with 18 to 45-year-old women suffering from postpartum depression showed that saffron was effective in reducing their depression. And a group of women aged 18 to 45 dealing with premenstrual syndrome found that saffron was effective in relieving depression during 2 menstrual cycles. Saffron is a smooth muscle relaxant and it helps to lower blood pressure, likely because of its inhibitory effect on histamine H1 receptors, stimulatory effect on the beta-2 adrenoreceptor, and agonistic effect on the muscarinic receptor. Saffron inhibits acetylcholinesterase, which breaks down acetylcholine in the brain, improving the brain signaling and helping with learning and memory. Saffron inhibits the deposition of amyloid beta peptide fibrils, which has been implicated in Alzheimer's. Several human studies show that saffron is as effective as some popular antidepressants in treating mild to moderate anxiety and depression. Some of the symptoms of Parkinson's disease originate from underutilization of dopamine in the substantia nigra area in the brain. Studies show that saffron helps to protect the substantia nigra dopamine neurons associated with Parkinson's disease. Newly published studies show that saffron helps to protect your eyes from ultraviolet blue light radiation and flicker sensitivity from glaring monitors and headlights. Saffron improves the oxygen and nutrient supply required for healthy eyes by boosting blood flow in the retina and the choroid of your eyes. Many users report that supplementing with saffron has helped them to stop eating junk food, avoid nighttime snacking, and they're no longer obsessed with thinking about food all the time. It's been proven to help with age-related macular degeneration. Vision may be sharper, and you can see a line or two further down the Snellen chart at your next eye appointment. Glare from headlights during nighttime driving and flicker from monitors is no longer a problem. You may experience improvements in mood when supplementing with saffron, no longer overreacting, and work-related stress now feels like you're in control again. Many users report an increase in energy and better libido also with saffron. Feeling tired and emotional is a thing of the past. You're back to bright, positive, happy again. Clinical research in the efficacy of saffron is encouraging, but trial lengths have typically been limited to 4 to 6 weeks, and sample sizes are relatively small. And keep in mind of the potential for bias, because most clinical trials with humans have been conducted in Iran, which produces nearly 90% of saffron for the world market, but there's still some high-quality studies. A double-blind, randomized trial with 40 adult outpatients suffering from major depression was conducted at the University of Tehran. The study comprised of saffron petals with fluoxetine for the treatment of depression. The patients were given 15 milligrams of saffron petals in the morning and evening, or 10 milligrams of fluoxetine morning and evening for 8 weeks. The study concluded that saffron petals were as effective as fluoxetine in the treatment of mild to moderate depression. The remission rate was 25% in both groups, with no significant differences in side effects. There's increasing evidence to suggest that saffron could be used in the management of Alzheimer's disease. In one Iranian study, 54 adults aged 55 years or older with Alzheimer's participated in a 22-week double-blind trial. The patients were randomly assigned 30 milligrams per day of saffron, which was 15 milligrams twice per day, or 10 milligrams per day of Aricept. The study found that saffron was as effective as the drug Aricept in the treatment of mild to moderate Alzheimer's after 22 weeks. Other research shows that saffron may inhibit the aggregation of amyloid beta in the human brain and may therefore be useful in Alzheimer's. 46 patients with Alzheimer's volunteered for a 16-week double-blind controlled trial. The patients were randomly assigned 15 milligrams of saffron twice per day or placebo for the 16-week study. After 16 weeks, saffron produced a significantly better outcome on cognitive function than the placebo. The study concluded this double-blind, placebo-controlled study suggests that at least in the short term, saffron is both safe and effective in mild to moderate Alzheimer's. 60 adult patients with anxiety and depression were given a 50 milligram saffron capsule or placebo twice a day for 12 weeks. Depression and anxiety questionnaire was used at the beginning, 6 and 12 weeks during the trial. The patients who used the saffron supplements had a significant reduction in anxiety and depression symptoms. The study concluded saffron appears to have a significant impact in the treatment of anxiety and depression disorder. Side effects were rare. The recommended dose of saffron is 25 to 30 milligrams twice per day for mild to moderate depression. Clinical studies have evaluated doses ranging from 20 to 400 milligrams per day. Doses of up to 1.5 grams per day of saffron are thought to be safe, with toxic effects reported for 5-gram doses. As with many nootropics, more is not always better when using saffron. Some research shows that doses above 1.5 grams of saffron can be extremely toxic. Genuine saffron is non-toxic and well tolerated by most people when using the recommended dose. Some reported side effects of saffron include headaches, nausea, dizziness, vomiting, and mania, especially if you're bipolar. Saffron can aggravate asthma symptoms. 5 grams of saffron is associated with toxic effects, and very high doses of saffron, 10 to 20 grams, can be deadly. No drug interaction has been reported, but interactions with anti-aggregating drugs are theoretically possible. Don't use saffron if you have a bleeding disorder. Saffron is especially helpful for suffering from anxiety and depression. Studies show that saffron is as effective as some popular antidepressants, but without the side effects. If you're currently using antidepressants, saffron may help to alleviate the sexual dysfunction caused by these drugs. Saffron seems to be an effective way to control appetite. No snacking between meals, and you're no longer obsessed with food. Saffron has the added benefit of more energy and stamina to help you through your day. You can safely take up to 200 milligrams of saffron daily if needed, but dosed 100 milligrams at a time. Be familiar with the associated side effects of higher doses of saffron. Saffron is also a very effective vision supplement. Driving at night is easier on your eyes, and the flicker caused by screens and monitors won't leave your eyes fatigued later in the day.